sensitive in the spirit. Our second speaker is Dr. Makinde, and she's a consultant family physician. She's a consultant family physician and a leading lifestyle medicine physician in Africa with certifications from the International Board of Lifestyle Medicine. She's a fellow of the National Postgraduate Medical School College of Nigeria and the West African College of Physicians. Dr. Makinde wears many hats, serving as the president of the Society of Lifestyle Medicine of Nigeria and a distinguished member of the World Sleep Society and World Organization for Family Doctors. She's the head of the Lifestyle and Wellness Unit, Department of Family Medicine. Additionally, she's a visionary founder of the NGO Lifestyle Champions International Foundation. Through this foundation, Dr. Makinde is building a vibrant community dedicated to advocating for healthy lifestyle choices with a focus on preventing lifestyle-related diseases. I'll stop with this. So, this has told you a bit about what she does, and I believe that many of us would want to listen. Especially when she talks about lifestyle diseases. We don't want this. So please pay attention. When the last speaker was speaking, somebody's phone was ringing. For those who came in after we started, please look for your phones and put them on silent. I need you to do that now. If you came in after the first speak, after we spoke, please look for your phone and put them on silent. Thank you. If you have two phones, look for the two phones. Thank you very much. Yes, please. Yes. So I want us to go for her. So please welcome Dr. Makinde.
Thank you so much, ma'am. Good morning, ladies and gentlemen. I want to bring you special greetings from my husband, Dr. Makinde, who is also a field rep in this fellowship. And I want to specially greet Mr. Tom Oboy and his wife, Mrs. Nancy Oboy. Thank you so much for inviting me. And greetings to all the board members and all the members of Southwest 7 districts. It's so amazing to be here. I was actually here last year, and so I'm so glad to be here again. Just listening to Ms. Yetunde, I was just thinking that even in the medical world, things are becoming digitalized as well. And that's why even in our training as medical doctors, everything, you can access it online. So we don't use all those scripts anymore. And then you can go for a surgery and it's a robot that is going to perform the surgery as well. And there's so much precision, when that robot, goes to do the surgery. Of course, it will be controlled by someone who has been trained, to carry out that procedure. So really, we need that new mindset. Now, I'm going to be speaking to us in the next 30 minutes about menopause and how we can navigate this new phase of life with confidence. Now, I know that not everybody has attained menopause, but if you know, okay. So if you know that you have attained menopause, sorry, I was told to speak up. I learned people at the back couldn't quite hear me. So please, could you just wave your hand? Let me just see your hand. Okay, yes, we have very few. Oh, more hands. Amazing. All right, so thank you for raising your hands, Matt. And I wanted to say the men should not run away, even though we don't have many of them here right now. But it's always good for the men to also be educated, to understand what the women go through, so that you can, be a support, for your wife during this period. Women go through different phases of life. I'm sure some of us remember when we attained puberty, when we had all those changes going on in our body, when we became pregnant, when we started breastfeeding, and now the next thing that comes after the age of reproductivity is menopause. So let's look at a few definitions because there are some other words I want us to be conversant with. So menopause in itself marks the end of your menstrual cycles and reproductivity, which is one of the major functions, in men and women. And I must say here that we also have something called andropause. In case the men are thinking it's just for the ladies, there is also andropause, and I'm sure that you would also have a session at some point, that would address that for our men in Southwest 7. So this is a time when there has been no menstrual periods for 12 consecutive months, and there is no other biological reason to explain the reason why the menses has stopped. And then we have what we call perimenopause. When we say peri, we mean something you're on the surface, you're on the brim of it, it's just about happening. And a lot of women in their 40s are already on the brim, of menopause. And it is a time during which the function in your ovaries begin to decline. Now, right from the time we were born, even when we're inside our mother's wombs, there was a certain amount of follicles, that were designated to be in the ovary. And as soon as we attain the age of puberty, every month an egg is released from that ovary. So depending on how early you started menstruating and how many children you had, that will determine how early you will also lose all the eggs in the ovary and no longer have this function. So the main characteristic, of perimenopause is irregular menses. You just discover that, I saw my menses this month. The following month is not quite, the way I expected it to be, and then it comes again. We also have the term climacteric, which is a period of life when fertility and sexual activity are in decline. So it is also a term that we just consider whenever we're seeing women who have problems with sexual activity and fertility. And we say, this woman, she might be in the climacteric. It might have to do with ovarian function. So this graph, it just shows you how the estrogen levels decline with age. So the estrogen is a female hormone. So it's usually high, in the middle age, from puberty to middle age. But once you start reaching the age of about 45, it begins to diminish. You can see the graph going down, and then the periods begin to stop. Usually the last period comes up at about an average age of 51 years, and then once it stops permanently for 12 months, we can say that that woman has attained menopause. So you can actually say the age when you attain menopause, just like you can say the age when you attained menarche. That's when you saw your first period. Next slide. So this still explains further about the duration. So you can be in perimenopause. Okay. So you can be in the perimenopausal period for about 6 years. And you'll be wondering, why would I be in the perimenopausal period for 6 years? It's because of the declining rate of the estrogen in the bloodstream. And so when this goes on and eventually the period ends completely, that's when we can now say you're officially at the age of menopause. And then post-menopausally, that could happen. You could experience some symptoms even up to 10 years, after, reaching the age of menopause. Thank you. Next slide. Why does it occur? Number one, it's a natural process. It's physiological due to the declining rates of estrogen, like I mentioned, and when the ovaries stop releasing eggs every month, and it marks the end of a woman's reproductive period. But there are some myths that we need to dispel, because some people feel that once I get to menopause, my sexual life has ended. But that is something that needs to be corrected. And there are ways that we can help a woman to still enjoy, sexual relations with her husband, as God intended. Next slide. Now, we have different types of menopause. It's supposed to occur naturally, but in some women, for some reasons, it might come as a result of surgery and as a result of chemotherapy. And then we have some people in which it occurs prematurely. I encountered a woman some years ago. She was about getting married and she was just 35 years old. And she wanted to get married, so she came to see me. She said she had concerns. What were her concerns? She had not seen her period in several months. In fact, up to a year, she had not seen her period. For a woman not to see her period for an entire year, it means that the ovaries were not putting out an egg or putting out eggs. And so we discovered that this woman had entered menopause prematurely. So that's what we call premature menopause. And it occurs as a result of premature ovarian failure. And it can be induced as well. So if that woman, for example, had surgery and she had a womb and the ovaries removed, that woman will enter menopause prematurely. And then some people need it because of treatment for cancer. So we've seen some people who had to undergo treatment for breast cancer even before the age of 40. So that treatment can also induce menopause. That's what we call radiotherapy or chemotherapy. Now, this hormone is a very important hormone, and that's why we need to talk about menopause and how we can navigate, life. There are things that we need to look out for, because this estrogen, it actually plays a very important role in our lives. All those curves, that you have as you grow from the age of puberty, when you get pregnant, remember how you looked when you're pregnant. Some people become more beautiful, when they're pregnant. It's because of these female hormones, estrogen and progesterone. So it plays a very vital role in our physique and our emotional well-being. So when it goes down, there are a lot of things that happen, and I'm going to mention those symptoms now. So that if you have those symptoms, you need to look for ways to abate or address those symptoms, and you don't need to be afraid, of what is next. So these are some of the challenges that people encounter. You can enter a room. Somebody can be in this room right now. The ACs are on, and you just feel a hot flash, come down your neck, and you just find yourself sweating profusely, and the AC is on, and everyone else around you seems to be enjoying the AC. So hot flushes are the commonest symptoms that women experience perimenopausally or during menopause. Some women also experience palpitations. Heat intolerance also goes along with hot flashes. So once a place is hot, you can't tolerate it. You just want to leave that area and get a fan or something. Chills, excessive sweating, night sweats, pain in the muscles and the joints, breast pain. I've had someone come to see me, and we had to do a mammogram, a breast scan. We did all the tests. There was nothing wrong. She just had pain. So this can come as a result, of menopause. Then urinary symptoms. This is also very important. You might just be sitting on a chair and talking with someone, and you laugh, and you just discover that some pee just drops, into your underwear. These are some of the challenges, that come because estrogen plays a role in strengthening the pelvic wall muscles. So once estrogen levels go down, then you lose the tone inside those muscles. And that's why people also have difficulty with sexual intercourse, because the vaginal walls too seem to be a bit more weak and dry. So vaginal dryness, itching due to shrinkage of the vagina walls, and headaches, low moods, mood swings, loss of energy, anxiety, difficulty sleeping. Of course, I've talked about reduced sexual desire, sexual difficulties. That's why the men really need to understand that the woman is not doing this intentionally. When she turns away on the bed, it's not like, oh, I don't want it, but what she's going through at that time is what is influencing her emotions and her behavior. Loss of breastfulness, that is also a concern that a lot of women have. Dry skin and thinning hair. So someone very close to me recently, her hair started falling off.
in patches. And we're thinking, this is alopecia. What would cause this? We tried, to find out what it could be. At the end of the day, we discovered it was linked to perimenopausal symptoms. So those are some of the things that could happen. But thank God for wigs. Thank God for things that we can use to make ourselves look better. Yeah, so this must be a very familiar scene, I'm sure. When we go for weddings now, you see people holding fans, you know. Maybe some people are holding fans. I don't think so right now because the AC is on. Okay, you have one, ma. Oh, yes. So this is a common scenario. Some of us hold fans because of, our makeup and all that. But this, just imagine feeling like this almost every day, for a year, not at a party because you tie the gele and put on, makeup. So those are some of the challenges that women face. So let's go to the modalities. Okay, so just to also brief us on some medical conditions. You know what I mentioned earlier, there are more of symptoms, but there are some medical conditions that we need to take note of. We need to screen for them so that you don't end up becoming maybe hypertensive or diabetic or having a urinary tract infection. So for women who have not had babies and they are already close to the age of 45, we usually say do something about it on time. Don't wait. We have what we call in vitro fertilization now, IVF. So I discovered that some women will wait until they are 50, and that's when they now start coming to the hospital to say, oh, I still want to have a baby. So we want to encourage women, once you know that you've not had a baby and you want a baby, you don't want to adopt, please assess care on time because infertility is one of the issues that comes up when a woman reaches the age of menopause. Then urinary tract infection due to the weakness of the bladder wall, that woman can begin to pee a bit more. So organisms can ascend into the tract, urinary tract more readily and have infections. So I'm going to teach us something that we can do to strengthen, the bladder wall and the pelvic wall muscles. Heart disease is also more common. So women who had not had high blood pressure before the age of 50, we just suddenly discover that the blood pressure goes up. That's because estrogen has a protective effect on our blood pressure. And that's why when people say, oh, this period has come again, I don't want to see it, we should actually be happy that the period is coming because it's the estrogen that is driving the period. And once it goes away, we are going to lose many other benefits, but we can learn how to navigate. So, hypertension, heart disease, and then loss of bone density. That's also something that we need to take note of. There are some activities we should be doing now before we reach the age of menopause so that we don't end up with osteoporosis. We don't end up with pathological fractures. Bronchial obesity. This is also something that women have concern with. You had that figure 8, then suddenly the middle seems to expand. It's not because you are eating more, it's because of the hormonal changes. And so that's why we call it the middle age spread between your middle, between the chest, your under the breast, and the thigh. We just discovered that that place expands. We call it the middle age spread. Some people call it hormonal belly because it's due to the loss of estrogen. Estrogen plays a role in spreading fat, distributing it across the body so that it's even. But once you don't have enough of it, everything gets sequestered, to the middle. So it means you need to be doing something, intentionally to avoid this from happening. So this is just a photo that shows some of the problems that I highlighted earlier. Next slide. So if we want to make a medical diagnosis and you come to the hospital, especially for people who have gone through premature menopause, we check for the presence of the follicle stimulating hormone. So that is a test that you will need to do. So in case you are concerned about your menses, am I really menopausal or postmenopausal? You can ask for this test, follicle stimulating hormone. So if it is very high, it will show that that person is in menopause. Next slide. So what is the focus, in treatment? Like we said earlier, menopause is natural, physiological. It really requires no treatment, but we need to manage our symptoms so that we can have that confidence. And one thing I believe is that God has given us everything that we need for life and godliness through our knowledge of Him. So any knowledge that is being passed to us, medically, we didn't just go and dig it up somewhere. There are secret things that God gave insight into. So it's just a number. And we need to also approach it with a heart of faith to say that, Lord, this might come, but I don't want to have these symptoms. You can tell God, just like Mr. Okboy said, when you have power, you can call things that are not as though they were. You can decree a thing and light will shine upon your way. And I've had testimonies, women who navigated menopause without many of these problems. All right, so the main focus is to provide relief of vasomotor symptoms I mentioned, like the hot flashes, to reduce the risk of unwanted pregnancy, because during the perimenopause, there might come a day that you will just release an egg incidentally, and that's the day that daddy decides that, oh, let's have some time together. And women get pregnant during the perimenopausal period because they have not actually attained menopause yet. So it's very important that we understand this and to maintain whatever contraception is necessary. Preserve the bone, like I said, so that you don't develop a fracture, to lower the risk of heart disease, and just to improve the overall quality of life. Next slide. So the treatment modalities, we have general supportive therapies, lifestyle changes, or what we call natural therapies, medical therapy, and of course spirituality, which I referred to. So we'll just take some of these briefly. So the first general supportive therapy that we find very useful for women because of the complaints of vaginal dryness and itching. Some people will think that, oh, this is a fungal infection. Maybe it's toilet infection. I sat on the toilet somewhere. That's why I'm itching. It's due to the shrinkage, of the vaginal wall. And so there are some moisturizers which are specifically made for lubricants that you can use that would help to ease the itching and the dryness, contain a bit of estrogen, and this will help a woman to at least still enjoy sexual intercourse. Then vitamin D3. Vitamin D3 is very important for the joints and for the muscles. And so a lot of women complain of pain in their muscles and bones around this period. And a lot of studies have shown that we have low levels of vitamin D3 generally, in Africa because of our skin color and because we don't get enough sunlight. We stay indoor, even though there's a lot of sun outside, we stay indoor. So vitamin D3 supplementation is very important, along with calcium. And vitamin D3 will help the absorption of calcium into the bone to make it stronger. Then exercise is also very important because it builds bone density and stabilizes our joints. So if you have not been involved in any in any exercise, you need to think about that. I'll still mention that briefly. And then there's some relaxation techniques as well. I'll mention that briefly. So let's talk about dietary modalities because this is very key. Remember I said that estrogen levels go down, but there are some foods that we can take that actually contain phytoestrogens. So when you take the foods that contain phytoestrogens, it can help to balance the levels of estrogen in the bloodstream so that you don't have so much of those issues and those symptoms we talked about. So I would mention some of those plants that contain phytoestrogens. Phyto means it's from a plant. Anything that's plant-based, really, that grows from the ground, but there are some seeds. I listed them. I will show us shortly. Then we need to avoid triggers. There are some things that can trigger a hot flash. You're already in the menopausal age and you go and take very hot, spicy food. You take alcohol or you take caffeine, maybe 3-in-1, things that have a lot of sugar, processed foods, all these things that contain a lot of flour, butter, sugar. They are actually inflammatory and they would add, to those triggers and make you have more of the hot flashes and all the other symptoms. Then there was this study, the China health study, which showed that women who had a high level of soya bean intake or they were taking tofu, from soya beans, they noticed that they didn't have pronounced symptoms And that was because of the presence of these phytoestrogens, inside the soya beans. So it's very important that we make dietary adjustments so that we can optimize our weight, we can optimize our cholesterol levels and blood sugar, because these are some of the problems that come up when women become postmenopausal. Next slide. So which one would you choose? If you were given an option to have a bowl of maybe a bowl of ice cream, and to take a hamburger, and beside it they say, okay, we also have almonds here, we have avocado here, we have some carrots. What choices are you more likely to make? So we need to change our mindsets and move, you know, from those highly processed, super processed foods, and take more of the plant-based foods. That will help us to navigate it better. And same thing with drinks. How many of I'm so happy that we don't have any colored drinks on the table. And anytime I see those drinks, my heart palpitations are like, oh my goodness, people are drinking this so much sugar, whether it's found in the malt, it's found in Fanta, Coke, Sprite, they contain so much sugar and we don't need it. We don't need it. What we need to go for is water. Once you are thirsty, drink water. So this can also help you to rehydrate better, during this season. So general principles for healthy eating and to reduce the risk of the chronic diseases that are associated with women when they get to the menopausal age, you need to avoid red meat. Red meat is anything that comes from an animal, whether it is cow, whether it is goat. This is based on studies. Scientific evidence has shown that people that eat more of, red meat, they are more likely to have heart disease. They are more likely, okay, ma, they are more likely to have diabetes and all these other problems that women did not even have any idea of, before they were menopausal. So avoid organ meat, replace it with fish and poultry. Avoid late meals, taking meals at 8 p.m., 9 p.m. Some people tell me, oh, I eat at 1 a.m., I'm fine. So all those things will um, will make people put on weight. Eat breakfast, make sure your meals are regular, don't eat late. Reduce calories from carbohydrates, especially refined things, bread, bread every day. You want to snack, you eat bread, white rice, pastries, biscuits, sweets, smashed potatoes. These things contain high calorie levels. So you want to look at other foods. It doesn't mean you can't eat them at all, but they shouldn't, be high on the radar. Things that have a lot of plants, that have a lot of vegetables and fruits. Avoid all these high energy drinks and beverages. Ensure you eat protein, beans, tofu, fish. There's some nuts. Snack on fruit and nuts. I was in the office yesterday. I was hungry. I got almond nuts to snack on. That's not the time to ask for a bottle of Coke. Reduce all salt, oils, and frying. So these are the general principles that will help manage your weight. Next slide. Then I talked about vegetables and some seeds that are useful because they contain those phytoestrogens. So they've been called belly blasting foods. Why are they belly blasting? Because they encourage the level of estrogen, which will help to reach distribute, that hormonal belly I talked about. And we have all our local greens, ugu, bitter leaf. We have cabbage, spinach, beetroot. We have different fruits, oranges, grapefruit, tangerine, even fiber, whole grains, brown rice, whole wheat bread, whole grain cereals. Not that you make your pap and sieve it. You want to retain all the fiber in it and don't let the goats have the best of the corn or the guinea corn. So we have seeds, we have different types of seeds, flax seeds, sesame seeds. You can get them, buy them, blend them, and put them on your cereal. You will really enjoy it. Next slide. So other lifestyle modalities, I talked about exercise earlier. So the kind of exercise that we're prescribing is aerobic exercise. Aerobic exercise is something that improves the circulation of oxygen, throughout your body. So it's something that will make your heart beat faster and make you breathe faster. So we're not just talking about taking a stroll, but taking a brisk walk, walking fast as if you're late for an appointment. Promotes sleep quality. It will help with mood because one of the problems women encounter during menopause is a depressed mood, a low mood. But exercise, regular exercise, will help to release endorphins, the feel-good hormones, into your system, and you just find yourself feeling on top. Kegels exercises is something you can do while lying down or while sitting down. It's just like holding your pee, even though you don't want to pee. So you can just contract the muscles. I'm doing it right now. You can just contract the muscles in your tummy. Just hold it as if you're trying to hold pee. I will show us a photo. It strengthens the pelvic floor muscles and controls that pee that could easily drop when we laugh. Healthy social connections is important. It's important now to have good relationships with our family members and our husband. Let's not ignore it because we'll need it later. Because when we don't have healthy social connections, it actually leads to more inflammation, within the system and aggravates all these symptoms I mentioned. Sleep, restorative sleep. Some of us don't pay attention to sleep right now, but you are going to need it later because when you're in menopause, the symptoms you have can actually disrupt sleep. So you need to learn sleep hygiene measures right now that you can employ and get used to because it'll be very helpful. And it has to do with what you do before bedtime. How soon do you eat? Between um and or what is the latest time that you eat before bedtime? We advise that you shouldn't eat more than 3 hours, before bedtime, or less than 3 hours before bedtime, so that can also help you to sleep better. Then avoid screens, the TV, making calls just before bedtime. All those things will keep you, alert. Then we also have deep breathing. Deep breathing means you can take a deep breath in right now. Just take a deep breath in. Can you do that for a minute? Hold it and breathe out slowly. So you can count to 4 when you are taking in the deep breath. Hold your breath for 6 seconds and then release it over 8 seconds very slowly. It also helps to relax. Guided imagery, changing, negative thoughts, reframing them, and also progressive muscle relaxation. You could do it while lying down. You tense a particular group of muscles, maybe on your face, and relax it. You go to the shoulders, tense it, relax it. To the abdomen, tense, relax. You can do each of that for 10 to 20 seconds each. It also helps to relieve anxiety and tension. Avoid smoking as well. Next slide. So these are the steps for doing Kegels. Like I mentioned, you could lie down flat and just pull in your muscles. Draw up your muscles as if you are trying to hold the flow of pee. And then do it for 3 seconds. Relax for 3 seconds. You can do it 10 times in the morning and then 10 times in the evening. Next slide. Then strength training is also important. Apart from the brisk walks that I talked about, that will help to populate your brain with endorphins and make you feel good, then you can also do strength training. So these are some examples. You can do squats, you can do planks. These are things that you can find online in the digital world. Learn how to do them. They will strengthen, your bones, your joints as well. Next slide. Medical therapy is also available, but you have to do it under supervision. So there's what we call hormonal replacement therapy. We have pills, we have patches, estrogen patches. Estrogen patches are actually better, than the pills, because the pills will come with a lot of other risks. So we also have testosterone supplementation, because we also have some level of testosterone, even though it's a male hormone, but we have some level of it. And then vaginal estrogen cream, which I mentioned earlier. Some women need cognitive behavioral therapy to treat depression. There was a woman that met me some years ago. She said she did not know she was in menopause, but she had very severe effects. She became depressed and she didn't know it was menopause that was causing it. So in that case, the person might need a psychiatrist. Next slide. This is a special warning for anyone that decides to go along with the replacement of estrogen within the blood. They could actually develop vaginal bleeding undiagnosed, and you will need to find out and be sure it's not endometrial cancer or ovarian cancer. They could develop severe liver disease. They could have venous thrombosis. Some of us have heard about DVT, and also increase the risk of breast cancer. So these are some of the
warnings. And of course, if you're replacing estrogen, that means you could actually get pregnant. I think the next slide should be the last. Thank you very much, for your attention, and I'll be glad to take any questions.
Thank you so much,